Hey, this is Steve Jordan, and today I'm going to talk to you about posture. Posture is something that has been really very important to me because I personally had back surgery 6.5 years ago, and I had to work on my posture not only statically but dynamically. And it was a really challenging time during my life where I was a 29-year-old where I felt like I was 89 and I could barely move, I could barely walk. And I had to find solutions to be able to do that. But prior to even having that back surgery, I created something called Steve Jordan's Posture Perfect program. It was a program that I trademarked, that I put together a video and a manual that sold internationally. It was very successful. Men's Fitness did a feature article on there with over 6 pages of exercises and stretches that people were able to do at home and be able to start to alleviate some of the musculoskeletal pain and back pain and neck pain, shoulder pain, hip pain that they were experiencing on a day-to-day basis that was preventing them from moving more frequently and getting to some of their weight loss goals and some of their other fitness goals. So it's been quite a while. It's been almost 4 years since Posture Perfect has been out in the market and in the world. I took it down because it was done on VHS, which today VHS is so obsolete. So I wanted to reintroduce Posture Perfect back into the world, and today we're going to start by doing that. And Posture Perfect was a program that was using a foam roller, which I trademarked a name for the foam roller called the Posture Pillar. And the Posture Pillar is a tool that's used in the fitness world, physical therapy world. It's been used for over 15 probably years. And people have seen a tremendous amount of benefit from it. Some of the results that I was seeing with it from people from around the world were awesome. And you can purchase one of these at a Relax the Back. You can purchase them online. If you just type into Google and find foam roller, you'll find maybe a store that's convenient for you in your nearby area that will sell some of these. They range from anywhere from $15 to $30. I prefer the black one because it has a longer life and is a little bit more dense. So if you are sensitive, you might want to use one that's white foam, but it's not going to have a long life and it's going to feel a little bit more cushiony. The other thing you can also do is use a medicine ball. Medicine balls are also really dense and harder, but if you don't have the ability to get a foam roller, you can use that as well. And so the first area that I really address, in areas that I call predictable patterns of stress, areas with people who have tightness, areas where foam rolling or self-myofascial release can help to relieve musculoskeletal tension is the calves. So the calves are directly related to the ankles. And a lot of people, especially women who wear high heels, tend to get tight calves. You have to also think of some of the things we do in our day-to-day life that cause our calves to get tight or overworked. And that's maybe driving. It's also walking up and down the stairs. So if we don't have good flexibility in the calf area, we're going to have a lot of other distress through the body because the body's a chain. And so that chain is going to be affected beginning with the ankles. So what I'd like to do is teach you how to foam roll on your calves today. So the calves, what I do is I place the foam roller perpendicular to my calf. I get right into the belly of that calf and I apply some overpressure with my left leg. And what I'm doing is I'm looking for an area of sensitivity, an area that you'll know that's a little bit more sensitive than some of the other areas. And I just slowly just kind of work into that muscle and find that area of sensitivity, and I hold it there, like I've got one right now, for 30 seconds. And about 50 to 75% of that pain will subside. So you actually will feel less of that sensitivity that you felt when you first got onto that area. And you want to make sure your posture during this area is good. Remember, it's all about Posture Perfect. So you want to keep your chest up, your head up, keep your abdominals and core braced so that you have good upright posture. Hold that position there for 30 seconds, and again, you'll feel that subside. What I like to do, depending upon time, is find 1 to 2 to 3 areas in that area that you're focusing on. So right there, I didn't have to move very far, and I found something that really just lit up for me. And I'm going to hold that there for 30 seconds. Okay, once I find those areas and I move on to the left side, again, put the left leg on top, right into the belly of the calf, perpendicular to the foam roller, and I apply a little bit of overpressure so I don't have to lift up my butt. You can lift up your butt, but what that often tends to do, a lot of times I see people not being able to support their upper body weight. And they end up just having that that bad posture. So again, remember, it's all about posture perfect. And we're going to hold that there. Okay? The next area and final area that we're going to cover today in the Posture Perfect program in the area of myofascial release is going to be the quadriceps, so the front of the thighs. Another area that can get really tight from overuse. So we lie face down and we put the foam roller on both sides, and we want to keep this perpendicular. We want to roll up and down nice and slowly and be able to find an area of sensitivity. During this time, I'm going to keep my abdominals braced and my core upright, so I'm getting a core workout here as well. And I found a little bit of area sensitivity on my right side, so I'm leaning a little bit more on my right side to find one area. It's a little less stressful than doing both at the same time, and it's a little bit more targeted. Okay, I found that area, I release it. Again, I go find 1 to 2 more areas in that particular side. I adjust now going over to my left side. Find an area of sensitivity, hold it for 30 seconds, and you will feel and see that pain subside, like it's already subsiding for me within 10 seconds. It means your muscles are healthy and their ability to respond to the work that you're doing is very treatable. Okay, so those 2 areas are just specific areas that I like to focus on with predominantly 99% of my clientele. Whether I have done a postural assessment on them or not, I know that if I can work out the calves on that foam roller and I work out the front of the thighs, I'm going to be able to really address some of those predictable patterns of overload that the body's not able to move properly in. So once I get that done, I'm going to be able to address a strength program and then another flexibility program that will be able to just finish off with that Posture Perfect program. But I want you to tune in next time and go to the next series on the exercise that I can relate to this particular postural deviation that is related to the calf and the front of the thigh. So stay tuned, come visit us next week and next time, and I look forward to seeing you again.